Hi, I'm Christabel Sammy.
And I'm Narafia Lever.
And we're wanting to do a little bit of a series for you guys. So every Tuesday we're going to post a video here following you through thinking about getting pregnant and then when you're pregnant. And so they're just going to be short, sort of 9 or 10 videos designed to kind of answer some common questions and give you guys some thinking and talking points.
Yeah.
Because we kind of want to engage you in your health and so that you have all the information to decide what's right for you guys.
Exactly. Just to get better informed as well, because I think that's one of the things that women sort of say, that they didn't get enough information for them to make a decision.
And sometimes when you do look for information, you're just randomly Googling, and there might be some things that aren't really appropriate or
or you hear a lot of things like on some of the forums and that.
So we're going to try and demystify some of it and give you some of our medical input, but with a holistic swing to it as well.
Yeah, I think so.
Yeah. Just a medical disclaimer. Obviously, we're not trying to take over with being your doctors and nurses in terms of the advice that we give you through these videos.
No.
It is general advice, and it might not always be applicable to you and your family or situation. So we do ask that if you're wanting to use any of it, take it to your own doctors and nurses and midwives so you can start the conversations.
Yeah, absolutely. And that's with everything that's given to you. If it doesn't fit for you guys, then just leave it alone.
Yeah. Leave it be. So why don't we find out a little bit about Narafia?
Yes. Well, so I've been a midwife for 5 years now. Didn't really pick to be a midwife. They say, midwifery calls you. But in my family, I found out when I was doing my midwifery training that one of my great aunts was a traditional midwife.
Oh, wow.
So that was really cool. She's still alive, but unfortunately, she probably doesn't have much memory to kind of be able to share some of her information, because she used to do really cool things like using massage to turn babies and stuff when they're like in breech position. So
no instruments and all
no
of that.
No instruments, So I'm just like, I really like that kind of traditional, and just I would love to find out more about how she did, that sort of thing. But that aside, I suppose my approach is very holistic, and when people meet me, they probably are aware that I, quite spiritual or whatever. So in my clinic room, you will probably see a crystal or two.
Her room always smells amazing. Always smells amazing. Loads of essential oils, but it's just a very calming environment.
Yeah, and that's what I want to kind of create in the atmosphere. So, because sometimes you can get information that's really scary, and you need to be able to discuss it in an environment that's not going to add to those fears. What else? So, I've got some things on my notes here. So
we wrote some notes, so we didn't digress because we're chatty people.
Really bad.
So we thought we
give
us a little map.
So, I wrote here, I probably have more of an integrative approach. That's probably like one of the buzzwords here. So not just looking after your physical health, but emotional, mental, spiritual aspects of care. And I also use complementary therapies. So, and a lot of the stuff that I would suggest or recommend is all evidence-based. So you're looking at the science of epigenetics, your microbiome, neuroscience, psychology, and a lot of the research around the use of the complementary therapies. And I like to think that I support women in a very safe space. Absolutely no judgment. Probably that one midwife, you can tell me the most craziest shit, and I'll just go, cool. Interesting.
Each to their own.
Exactly. And a fun fact about me, because Christabel said, throw in a fun fact about yourself. So anyone,
I haven't even got a fun fact for me, so.
So anyone who knows me knows that I love to hike. My husband takes me away on some really cool holidays. We go to some great destinations, so we go hiking. And I do like to talk to trees and rocks, which is probably not surprising. And my mother-in-law, may she rest in peace, used to say that I'm away with the fairies, but I just like to think that I'm just tuned into another frequency. So, So, a little bit about myself.
And myself, so my name's Christabel, and I'm a GP, and I have been for the last 18 months running a family-run GP practice. in Rockingham.
Yeah.
And I fell into doing some of the midwifery and antenatal stuff, if I'm honest.
Yeah.
So I'd been a GP running my business here, and we had a talk with Robin Lynn.
Yeah.
Sorry, I've got all tongue twisted there.
Yeah.
And she is an amazing midwife.
She is.
Amazing world
Absolutely.
midwife.
Yeah.
And she came and did this talk in Rockingham talking about her views on childbirth and labour. And I was just really intrigued because something that I've known really, thought all through medical training and experience, is that we often, wherever we are, so I've lived in loads of different countries. If you're in Australia, the evidence will say do one thing. If you're in a different country, it'll be a completely different mindset or different culture. And I just wanted to be a doctor that was open to different cultures and viewpoints and things.
Yeah.
Because we like to think just everything we do in Australia must be the only way that it is
Yeah,
done and
absolutely.
the right way.
Yeah.
But we have women that come from different cultures and they will have ways of managing themselves and their pregnancies that are completely different to us and can sound scary because we might not know that much about it. But I'm really interested in trying to kind of learn about it and see how we can support women through their decision.
Yeah. Well, I think like in all cultures, whether it's like, Western, Caucasian, whatever, there has always been some traditions that women just knew and they shared. I mean, because it was a woman's domain, midwifery and pregnancy. And so a lot of these traditions now are kind of being resurrected because women understand or are aware, like, how, one, it's important, and two, it makes absolute sense, your self-care, particularly like in the postpartum. And, a lot of the things that they do during pregnancy even, it might sound really simple, like, keeping warm or eating, nourishing foods, but when you think about it, that's exactly what you need to do.
Yeah.
Right?
Yeah.
Something so simple like that. Yeah.
And I guess when I heard a bit about different antenatal options and how it was a little bit harder locally for people to get the kind of care that was female-driven, woman-driven, I wanted to kind of get involved with midwifery and offer more choices. And we keep using this word integrative or holistic.
Yeah.
And really what we're meaning is you don't have to come here and do holistic things if you don't want, like complementary things if you don't want to. You can go all medical. When we use that word, we're really just meaning you guys can kind of get all the information and decide on what you want to do. And if that's all medical, great. Yeah. And if it's a little bit of both or if it's, 80-20, you can kind of do that. So when we say we're doing holistic medicine, it's kind of just gone are the days where you used to go to the doctor and the doctor said sit and you go, okay, fine, or take this medication. You didn't know what it was. Yeah. You didn't know if there were alternatives. You didn't know what would happen if you didn't take it. Yeah. And we're trying to change that and just give you the options, the evidence, the facts, our experience. Yeah. And then you make the decision for yourselves, whatever that is.
And and I think that's one thing that I have to say. It's like your practice is quite unique here, Christabel. And that's the only reason why I decided to come and work here. Because it is so refreshing to have a doctor who is just completely open to that. And then you don't kind of feel like, oh shit, I can't ask this or I can't kind of offer that.
Yeah. But equally to not offer too much of one thing.
Oh,
so,
absolutely.
I do prescribe medication.
Because you do need a combination of both,
exactly.
Actually.
I think we need to take the best of the Western medicine, if you like, and the best of the, Eastern, there we go,
ways,
to kind of give you guys the best care. And I'm really a fan of giving care in the GP setting, because having a baby especially is not a medical problem or a condition. So when we take it away from hospitals where possible and away from making it medical, I think it gives you guys better outcomes.
It's just normal. It's just a normal, life journey, and it should be
in the family practice. So that's why we're trying to help you guys. So today was a little bit kind of getting to know us, really. The next videos will have a little bit more of a topic, and the next video that we want you guys to stay tuned on next week, next Tuesday, will be on sort of
Baby on the Brain is the title I've come up with. Baby on the Brain. So if you're trying to conceive,
or you're thinking, do we want to have a kid? When do we need to do it? What are the things? So
how do we prepare?
How do you get pregnant? well,
Sex.
it's not the
Let's talk about sex,
birds and the bees conversation. We're going to give you a
really.
little bit
It is
more.
really,
Actually, yeah, it's
Christopher.
true, actually. It's all about sex. That's controversial.
Oh my god.
Oh no. We said we wouldn't be controversial.
I know.
So yeah, that's the next topic. So
Yeah.
tune in next Tuesday and do us a favor, subscribe to this channel so you get a notification every time we post a video.
Yeah.
We'll see you in the next couple of weeks.
I think so.
Bye-bye.